Go to the right.
Or the right?
Yeah, there's a present.
Oh, there we go. Thank you. Okay.
Perfect. So we are presenting on managing long-term care facilities. Next. Okay, so the history of long-term care. As a human race, we have been getting a better quality of life. So we're also having a longer quantity of life. So this has created a new problem of people living longer and needing help to live well. So before all this, before there was any long-term care, it was just up to the elderly's family to take care of them. There were some public institutions, but they were mostly like homeless shelters or poorly run nursing facilities. So President Henry B. Lyman in 1965, he created the Older Americans Act and Medicaid so that the elderly could remain in their homes longer and still be part of the community. Next. So that act or that bill he passed was called the Great Society. So the Older Americans Act, or the OAA, its whole point is just to help people stay in their homes longer when they get old. So part of that is Meals on Wheels, or food delivered to them by communal meals. And then there's family caregiven support. There's health services so that they can get help in their homes. And then there's job training and volunteer opportunities so that they have something to do or that they have an opportunity to have a job when they're older. And then there's also protection from elder abuse. And then the other part was Medicare, and that is for the elderly and the disabled. So just remember that all of that was passed in 1965, and it was by Lyndon Johnson. Next.
So there's different leading national professional advocacy organizations that represent long-term care. The first one that we have chosen to share about is the AAHSA, which stands for the American Association of Home and Services for the Aging. It's a nonprofit organization. It has about 5,700 members. We've also covered the LTCCC, which is Long-Term Care Community Correlation. And that is kind of the watchdog of these organizations. There's also a couple more large leaders, the National Citizen Correlation for the Nursing Home Reform and California Activists for Nursing and Home Reform. Now in hospice and rehabilitation advocacies and organizations, there's a NAHC, which is the National Association for Home Care and Hospice. There's also the AHA, which is the American Hospital Association. This was found, as we know, back in 1898, and it kind of set the vision for healthy communities in America. And then also we have the American Rehabilitation Counseling Center that educates people and helps support those with disabilities and just all around helping people throughout their life. And then we also have the NRA, which is the National Rehabilitation Association, and they're advocates for the rights of individuals with disabilities. Now, the federal and state agencies, we all know Medicare. Medicare has created different tools that can help those that are aging or help the families for those that are aging. There's just different checklists that they have to help you find the right long care term facility for your loved one. And then there's also the Administration on the Aging. So these are just a few of the leaders of the advocacies that we have found to be important.
So there are many structures in the long-term care industry. There are technically 7. There's home health, assisted living, nursing home, skilled nursing, hospice, rehab, and memory care. So about 73% of the long-term care that's provided in the U.S. happens in the home environment. Starting one of these home healthcare businesses can be difficult. There's a lot of liability and responsibility that comes with it. It requires a lot of care and forethought before you want to start one. Each state has their own requirements in licensing, so it's important to know what your state's requirements are. Next. So there is assisted living, and it is regulated by each state. And this is for patients that need help with the 5 activities of daily living and kind of need round-the-clock watch just to make sure that they're okay. There are size requirements for every room. There are actually a lot of similarities between the state regulations, but there are a lot of differences as well. Some of them are medication management, staffing requirements, Medicaid waivers, memory care requirements, administrative requirements, and physical building requirements. Next. Then there's nursing homes. Each state has to comply with all these different rules to gain funding from the government. So residents, the first one, residents must have adequate nursing care, comfort, and privacy. Their rooms must accommodate no more than 4 residents. They have to have direct access to an exit. They have to have at least 1 window in their room, and it has to be equipped with or located near a toilet and bathing facility. Next. It must also be at or above ground level. No one can be in a basement. It has to be designed to ensure full visual privacy. They have to have a separate bed for each resident to accommodate their size and height. It has to be a clean, comfortable mattress, and they have to have appropriate bedding. And they must have functional furniture for each resident's needs. And then each resident has to have individual closet space with clothes racks and shelves that are accessible to them. Next. And then a skilled nursing facility has to be Medicare approved, and it offers short-term post-hospital care at a lower level than a hospital. It can also be part of a nursing home or a hospital. And then the state comes in periodically throughout the year to do inspections and report to the Federal Center for Medicare and Medicaid Services. These evaluations can happen at any time and without notice. And if a facility is found in violation of these regulations, they can either be fined or legal action can be taken against them. Next. And then there's hospice. Hospice is intended for those people that have 6 months or less to live, and their main focus is to manage pain for the resident. And they also provide comfort and care for the patients' families and the caregivers. It happens wherever the resident is living. That can be at home, or it can be in an assisted living home or a nursing home. And they believe that the quality of life should be as important as the length of life. Next. So these are some of the different things that hospice care does. It's important to remember that for your insurance to cover hospice care, you have to be considered terminal to be eligible for insurance, but a lot of it can be covered under Medicare and Medicaid and most private insurance plans. They usually cover all expenses, but it just depends on what kind of insurance you have. Next.
Okay, so with long-term care, there's medical, legal, and ethical issues that go along with it that you have to watch out for in the industry. So in assisted living, the issues that are outlined is assisted living facilities are admitting patients that need more skilled care than that they can provide. Some state agencies it has been said that some state agencies need to revise their assisted living standards to reflect their needs. And then, or otherwise, there'll be a continued injuries and death that will happen to the patients, as well as lawsuits against the facilities where the abuse or neglect occurs. And then in long-term care for skilled nursing / home care facility issues, the medical, legal, and ethical issues are physicians who provide care for nursing home residents are regularly challenged by ethical and legal issues because nursing home care is complicated by numerous regulations and because nursing home residents have more of a complex medical and social problems. Some of these issues are decision-making capacity, decisions about life-sustaining treatments, resident abuse, or the correct distribution of medications and risk management. As you can see on the slide, in the bottom left, right-hand corner, there's different types of elderly abuse that happens in some of these facilities. And then some other medical, legal, and ethical issues for hospice would be decision-making, truth-telling, respect for anatomy and choices, withholding or withdrawing treatment, clinical assisting nutrition and hydration, just a lot of things to consider. Another problem or issue that you have is insufficient compensation for those that care for these individuals. And then people that are just not comfortable with dealing with death, so they don't give them the right treatment that they need as they pass away. You'll see this is a graph of the long-term care market share. You can see that home health care is the largest in this market share, and then followed by that is the nursing care. Then you have your assisted living care, and then your hospice care.
All right, so there are 4 main sources of funding for long-term care facilities. So the first part is Medicare Part A. The federal government funds and regulates are given to citizens 65 and older, provided the recipients in need of skilled health care services that are rehabilitative or restorative. The care must assist the individual to a higher or better health state to be covered. It must be discharged from a hospital to a skilled nursing / rehabilitation center to qualify. The second one is Medicaid. This is state and federal governments share funding for those eligible, regulated by federal government and managed by individual states. Service is provided to those in need of skilled / rehabilitative care. Funds from a combination of state general fund dollars and federal matching dollars. Next. And then the third one is the Quality Assurance Assessment Program. So this is provider taxes implemented on May 10th of 2002 to secure additional federal dollars to provide for rate increases, addressing the rising cost of care for medical services. And increased rates were paid for by assisting providers a tax, which is an allowable Medicaid cost. These allowable costs are then matched by federal government to create a pool of funds to pay for the increased rates. Without this program, rates would have been flat in recent years due to the economic inflation factors. And then the last one is patient pay. The Medicaid program requires that an individual seeking nursing facility care meet a strict financial criteria and utilize available income to assist with paying for care. The patient pay amount is delivered primarily from Social Security and the resident's retirement benefits. Next. Okay, these are some of the challenges that come with managing long-term care. So the first one is HR. So that's dealing with people that you're working with. So that's a big part of healthcare administration. So in each facility, you have a wide variety of employees. Some are doctors, so they're highly educated, and then some, it's their first job and they don't have any education or job skills. So you have to help them all work together. You have to pay them all different amounts, and you have to make sure everyone's happy doing this. And it's hard because nursing homes or any sort of long-term care, they have a high turnover rate because it's not really where a lot of people want to spend their whole career. It's really a starting point, especially for nurses and doctors. They start there and then they want to get out of there fast as soon as they got some experience under their belt. And then the second part is financing, always money problems. So you have to know how to collect all that income from those different sources we talked about. So there's the CMS, so that's Medicare and Medicaid. You have to get sources from them, and then there's patients paying, and there's also other sorts of ways you get income to run your facility. It's hard because you're usually running on slim margins. This isn't a big money-making industry. And then you also have to make sure you're following the rules for your for-profit and not-for-profit business activities. And then the third is health insurance for employees. So these are considered high-risk works of area because you're working with patients that are old, frail, or disabled, and they can get hurt from not being lifted correctly or neglect or those little mistakes that can happen. And then also your employees, they're working with needles. When they're lifting people, they can get hurt. When they're working in your facility, they can get hurt. And you need to have insurance to cover all of that. So you're not liability. So next.
So I talked to the administrator at the assisted living home that I work at, and I asked her a few questions. The first one was, what kind of schooling did she have to go through to become an administrator? She said she earned her bachelor's degree in public health and then took the nursing home administration's residential care / assisted living examination, and that's how she became certified with the state. I asked her what some of the things she learned were and what she was quizzed on. She said that you have to know about age-related illnesses, management techniques, human resource operations, and counseling methods. Everything else is either common sense or you just kind of learn with experience the more you work. And then the last thing I asked her is what are some things that she would suggest to those thinking about going into this field of work. She said, work in the industry for a little bit to decide whether or not it's for you. It requires long hours. The residents require a lot of patience, and it can be exhausting. So she said start out small, like as a caretaker or as part of the kitchen staff, and then work your way up once you decide if you really like the atmosphere.
Thank you for listening to our slideshow presentation on long-term care.